Hi everyone. So today we'll be learning about the bones of the skull. The bones of the skull. Um, Now it's important to note that the bones of the skull can be viewed in 5 different angles or 5 different aspects. The first aspect or the first angle is the anterior part of the skull called the norma frontalis. Okay, that's the Latin word. Norma frontalis from the front. Okay, now the skull can also be viewed from the back. That's normal occipitalis. All right. The skull can also be viewed from above. That's normal verticalis. It can also be viewed from the side. That's normal lateralis. And then lastly, it can be viewed from below. That's normal basalis. Okay. Now for each of the view or each of the angle, there are 4 things we need to identify. Whether the normal frontalis, whether normal occipitalis, whether verticalis, whether lateralis or basalis. The first thing we need to identify is the bones that constitute that angle. Number 2, we need to identify the sutures. Number 3, we need to identify the foramina. And number 4, we need to identify the landmarks. So we'll start with the normal frontalis. Okay, so I said that for every angle, there are 4 things we need to identify. The first thing is that we need to identify the bones. So we'll identify the bones here. Okay, so this is the frontal bone. Okay, the upper part of the skull. That's the frontal bone. Okay, the second one is the nasal bone. This is the nasal bone. One on each side. So there's one here, there's one here. Okay, so this is the nasal bone. This is the nasal bone. And the third bone is the zygomatic bone. So this is the zygomatic bone, one on each side. Okay, this is the left, this is the right, zygomatic bone. Then we have the maxilla bone. Okay, so this is the maxilla, forms the upper part of the jaw. So this is the maxilla. And then the one forming the lower part of the jaw is the mandible. So this is the mandible. Okay, this is the mandible. Now the second thing we need to identify is the sutures. The sutures. Now the first thing we identify is the coronal suture. So this is the coronal suture. So you can follow my cursor. This is the coronal suture. The coronal suture is formed between the frontal bone and the parietal bone. So the parietal bone is in color green. The frontal bone is in blue. Okay, so the suture between the frontal bone and then the frontal bone and then the parietal bone is the coronal suture. Now there's another suture called the metopic suture. The metopic suture, which is usually found in infants. Okay, the infant skull. This is the metopic suture. Okay, usually found between the 2 halves of the frontal bone. So this is the frontal bone. This is one half of the frontal bone. This is another half of the frontal bone. So the metopic suture is usually found in infant skull. Okay, between the 2 halves of the frontal bone, and it disappears at the age of 2 to 6 years. Okay, the lower part persists in about 8% of adult skull. Now the persistence of this suture may be mistaken for a fracture. Now another suture we can identify is the frontonasal suture. Okay, so this is the frontal bone and this is the nasal bone. So the suture between them is the frontonasal suture. Okay, then another suture we identify is the frontozygomatic suture. So let's identify this is the frontal bone, this is the zygomatic bone. So the suture between the two is the frontozygomatic bone. And then another suture we can identify is the internasal suture between the 2 nasal bones. So one here, one here. So there's a suture between the 2 of them, joining the 2. So that's the internasal suture. Okay. Now, so regarding the frontal bone, it forms the roof of the orbit. So this is the orbit. Okay, this is the orbit. Okay, it has the zygomatic process. It has the maxillary process. Okay, joining the maxilla bone. Right. Now, when we say process in anatomy or in relation to a bone comes from the Latin word processus, which means that an outgrowth or a bulging. Okay, so the main bone is the frontal bone. The bulging or the outgrowth of the frontal bone is a process. So here, because it is joining the zygomatic bone, we say that this is the zygomatic process of the frontal bone. Here, because it is joining the maxillary bone, we say it's the maxillary process of the frontal bone. So now we need to identify the bony landmarks. Okay, so the four things we've looked at: the bones, we've looked at the sutures. Now the third thing is to look at the bony landmarks. So the bony landmarks of the normal frontalis. Okay, the first landmark we'll look at is the frontal eminence. Now see this red circle here, this is the frontal eminence. This is the frontal eminence, and it's actually the center of ossification. Okay, very important. The second landmark we need to know is the superciliary arc. Okay, so this is the superciliary arc. Okay, it's above the orbit. So this is the orbit. So this arc is above the orbit. So it's called the superciliary arc. Okay, this is the superciliary arc. This is the superciliary arc. Another landmark we need to identify is the glabella. Now, between these two superciliary arc, between the two superciliary arc is an elevation, okay, called the glabella. Okay, now just inferior to the glabella is a depression at the frontal nasal suture called the nasium. All right. Now we also have the nasal septum. This is the nasal septum. This is the nasal septum. The nasal septum. We have the middle concha and we have the inferior concha. Then we also have an eminence called the canine eminence. It is formed by the roof of the canine tooth. Okay, this is the roof of the canine tooth. This is the canine eminence. Now lastly, we identify the foramina. Okay, the first one we identify is the supraorbital foramina. So once we say supraorbital, means above the orbit. So this is the orbit. So this foramina here is called the supraorbital foramina. Here, one here, another one here, one here, another one here. Supraorbital foramina. Now it's important to note that the supraorbital foramina transmits the supraorbital nerve and then also vessels. Then we'll look at the infraorbital foramina below the orbit. So this is the infraorbital foramina here. There's another one to here, infraorbital foramina. It also transmits the infraorbital nerve and vessels. Then we'll look at the zygomaticofacial foramina. Okay, zygomaticofacial foramina. This is it, very small foramina here. Zygomaticofacial foramina also transmits the zygomaticofacial nerve and then vessels. The zygomaticofacial nerve and vessels. Okay, this is the small one here. There's another one too here. Okay, so let's have an overview of the normal frontalis, or the anterior aspect of the skull. Now we said that for each of the angles that we'll look at four things. We identify the bones, the sutures, the landmark, and then the foramina. Okay, so this is the frontal bone, right? This is the parietal bone in green. This is the zygomatic bone, one here, one here. This is the maxilla, which forms the upper part of the jaw, and then the mandible, okay, which forms the lower part of the jaw. Then we'll look at this, the frontal eminence. Okay, it's one of the landmarks. So it's a center for ossification. Then we'll look at the superciliary ridge. Okay, it's also a landmark. Superciliary ridge, we said it's above the orbit. Then we'll look at the supraorbital foramen. Okay, so part of the foramen, it's above the orbit. Supraorbital foramen, we said it transmits the supraorbital nerve and vessels. Then we'll look at the frontal zygomatic suture. Okay, suture between the frontal bone and the zygomatic bone. All right, so this is the zygomatic bone, this is the maxilla. Okay, this is the canine eminence. All right, this is the mental foramen. Okay, this is the infraorbital foramen. This is the zygomaticofacial foramen, transmits its nerve and then also vessels. This is the frontal process. Okay, this is the zygomatic process of the frontal bone. This is the frontal process of the zygomatic bone. This is the coronal suture. Okay, then we said that the nexion is a depression, okay, which is just in front of the nasal bone, And then we said between the two superciliary arch, we have an elevation called the glabella. Okay, so we'll look at another angle of the skull, which is the normal verticalis. Normal verticalis. So we are looking at the skull from above. Okay, now we have normal verticalis externa. So when we look at the skull from above, the external part of the skull from above is the normal verticalis external. Okay, so we'll follow the same routine. We'll look at the bones, we'll look at the sutures, we'll look at the bony landmarks, and then we'll look at the foramina. Okay, so to identify the bone, we have the frontal bone. This is the frontal bone. Okay, frontal bone forms the anterior part. Then we have the occipital bone, which forms the posterior part. Then we have parietal bone. This is the parietal bone, one here, one here. So we have one on each side. Again, we have the frontal bone, which forms the anterior part. We have the occipital bone, which forms the posterior part. And then we have the parietal bone, one here, one on the other side. Now, in identifying the sutures, we have the coronal suture. Coronal suture found between the frontal and the parietal. So this is the coronal suture. It's between the frontal and the parietal. The coronal suture. Then now we have the sagittal suture. It's found between the two parietal bones. So one parietal bone, another parietal bone. So this suture here is the sagittal suture. And then we have the lambdoid suture. It's between the occipital. So this is the occipital and parietal. So this suture here, okay, found between the parietal bone and occipital bone, is called the lambdoid suture. Now, for the landmarks, we have bregma. Bregma is the meeting of the sagittal and then the coronal suture. Okay, so we said that the coronal suture is between the frontal and the parietal. Okay, so this is the coronal suture. But bregma is the meeting of the coronal suture and the sagittal. So this is the sagittal, this is the coronal. So they meet at this point. So it's called the bregma. Now, bregma in infant is related to the anterior fontanelle. Anterior fontanelle. Okay, so this is the frontal bone, this is the parietal bone. The anterior fontanelle, it has a diamond shape. Now, it usually closes at the age of 18 months. Okay, that's the anterior fontanelle. Now, another landmark we have is the lambda. Lambda is the meeting of the sagittal. Okay, this is the sagittal and the lambdoid. We say this is the lambdoid. Lambdoid is between the parietal and occipital. Okay, so it meets here. This is the lambda. Okay, it's a landmark. All right. Then we have the parietal foramen. Okay, so this is the foramen. This is the parietal foramen. It transmits the emissary vein between the superior sagittal sinus and then the scalp vein. And then we have the parietal eminence. Okay, this elevated pointed feature of this bone, okay, is the parietal eminence. Is the site of the center for ossification. Okay, ossification. So this is the eminence, parietal eminence. There's another one to here, parietal eminence. Now it's important to note that for the lambda, okay, between the sagittal and then the lambdoid, okay, the lambda in the infant is related to the posterior fontanelle. Okay, it has a triangular shape. Posterior fontanelle. Okay, between the parietal bone and the occipital bone. The posterior fontanelle usually closes at 6 months. Okay, it's important to note that. All right, again, let's look at the bones of the normal verticalis externa. We have the frontal bone, we have the parietal bone, we have the occipital bone. Now, we said the frontal bone forms the anterior part, occipital bone forms the posterior part, and then we have parietal bones, one on each side, one here, one here. Then we looked at the sutures. We looked at the coronal suture between the frontal bone and the parietal bone. Then we looked at the sagittal suture. It's found between two parietal bones. So this is the sagittal suture. Then we looked at the lambdoid suture. It's found between the parietal bone and the occipital bone. Then we looked at the landmarks. We looked at the bregma. Bregma is the meeting point of the sagittal suture and the coronal suture. We said that it's related to the anterior fontanelle in infants. Okay, anterior fontanelle found between the frontal and the parietal bone. It has a diamond shape. It says that it closes at 18 months. Then we looked at another bony landmark called the lambda. Lambda is between the sagittal suture and the lambdoid. Okay, we said the lambda is also related to the infant, related to the posterior fontanelle, closest at 6 months. All right. Then we looked at a foramen on the on the parietal bone. Okay, parietal foramen, which transmits the emissary vein between the superior sagittal sinus and then the scalp vein. Then we looked at the eminence, parietal eminence here. Said is the site of the center for ossification. Again, we'll look at the normal verticalis interna. Okay, so we've looked at the externa. Now we are looking at the interna. All right, again, so we'll identify the bones, we'll look at the sutures, and then we'll look at the landmarks. Okay, so for the bones, this is the frontal bone, forms the anterior part. This is the occipital bone, forms the posterior part, and we have the parietal bone, one on each side, one here, one here. Then we'll identify the sutures. The coronal suture is between the frontal bone and the parietal bone. So this is the coronal suture. Then we look at the sagittal suture. It's found between the two parietal bones. So this suture here is the sagittal suture. Then the lambdoid suture, found between the parietal bone and occipital bone. Okay, so this is the lambdoid suture. Then for the landmarks, we saw the bregma. The bregma is here between the sagittal suture and then the coronal suture. This is the bregma. Okay. Then we looked at the lambda. Lambda is the meeting point of the sagittal suture and the lambdoid suture. So this is lambda. Then there's a groove here. There's a groove here extending from the frontal crest. So this is the frontal crest of the frontal bone. Frontal crest. It forms a groove all the way, extending all the way here. And this groove is for the superior sagittal sinus. The groove is actually for the superior sagittal sinus. Okay, it's found in the middle. Okay, the middle here, from the frontal crest all the way down. The groove is actually for the superior sagittal sinus. Okay, then you can notice that we also have some grooves here. There are some grooves here, and these grooves are actually for the middle meningeal vessels. Okay, middle meningeal vessels. Then we have granular foveoli. Okay, granular foveoli. These are the foveoli. This one here, this one here, this one here, this one here. Okay, granular foveoli. They are actually made by the arachnoid granulations. Arachnoid granulations. Again, the normal verticalis interna. We've looked at the bones: the frontal bone, parietal bone, occipital bone. Frontal bone forms the anterior part. Occipital bone forms the posterior part. Then we have one on each side of the parietal bone. Then we look at the sutures. This is the coronal suture, found between the frontal and the parietal bone. Then we looked at the sagittal suture, found between the two parietal bones. Then we looked at the lambdoid suture, between the parietal and then occipital bone. Then we looked at the landmarks. This is the bregma. Bregma is formed between the sagittal suture and the coronal suture. Then we looked at the lambda, between the lambdoid suture and then the sagittal suture. And then we looked at a groove here for the superior sagittal sinus. A groove, we said, this extends from the frontal crest of the frontal bone all the way down here, and it's actually for the superior sagittal sinus. Then we looked at some depressions here. They are also groove-like depressions. Okay, these impressions are made by the middle meningeal vessels. And then there are some granular foveoli here, okay, also made by the arachnoid granulations. Okay, so to recapitulate what we've learned so far, this is the normal verticalis. For the normal verticalis, we have the externa and we have the interna. Okay, just an overview. So we look at the bones, okay, of the externa. This is the frontal bone, this is the parietal bone, this is the occipital bone. Frontal bone forms the anterior part, occipital bone forms the posterior part, then we have parietal bone on each side. Then we look at the sutures. This is the coronal suture, okay, between the frontal and then the parietal bone. we looked at the sagittal suture between the two parietal bones, and then we looked at the lambdoid suture between the parietal bone and then the occipital bone. For the landmarks, we looked at the bregma. Bregma is between the sagittal suture and the coronal suture. And then we looked at the lambda between the lambdoid and then the sagittal suture. For the interna, okay, still we have the frontal bone, parietal bone, occipital bone. We said there's a groove here extending from the frontal crest, okay, of the frontal bone, coming down, extending downwards, and we said this groove is actually for the superior sagittal sinus. And we said there are some grooves here, okay, impressions made by the middle meningeal vessels. And then we also have granular foveoli, okay, also impressions made by the arachnoid granulations. So again, we'll look at the normal occipitalis. That's another angle, another view, okay, that's viewing the skull from the back, okay, it's called the normal occipitalis. Okay, so as the routine, we'll look at the bones. Okay, so this is the parietal bone, there's the parietal bone, all right, this is the occipital bone. Now there's another bone we are introducing. This is the mastoid bone, okay, parietal bone, occipital bone, mastoid bone. Now for the sutures, this is the sagittal suture between the two parietal bones, okay. This suture between the parietal bone and then the occipital bone is the lambdoid suture, okay. Then now we have another suture, a suture between the parietal bone and the mastoid bone, okay, called the parieto-mastoid suture. So this is it, okay, between the parietal bone and then the mastoid bone, okay, parieto-mastoid suture. Then we have another suture between the occipital bone and the mastoid bone, occipital bone and the mastoid bone. So this is the suture here, is called occipitomastoid suture, right? Then we identify the bony landmark. Okay, we have the external occipital protuberance. This is it, the external occipital protuberance. Okay, the impression made here is called the inion. Inion is the prominent point. Okay, inion. Right. Then we have the external occipital crest. So drawing a line down, this is the crest, just going below it. That's the external occipital crest. So now the lambda. For the lambda, we know the lambda is the meeting point between the lambdoid suture and then the sagittal suture. So this is the lambda. Then we have asterion. Asterion is the meeting point of three bones. Okay, the parietal bone, the mastoid bone, and then the occipital bone. So this is the asterion. Okay, the meeting point of three bones: parietal bone, occipital bone, the mastoid bone. Now this landmark has a clinical correlate, especially for neurosurgeons, because the asterion lies above the sigmoid sinus. Now we have three nuchal lines. We have the highest, superior, and inferior. Okay, so this line is actually the superior nuchal line, and then this is the inferior nuchal line. The highest is actually here, not too clear, not too visible. It's actually above the superior nuchal line. Okay. Then we have the mastoid notch. This is the mastoid notch. Okay, there's a notch here. There's one here. There's another one here. Okay, mastoid notch. Okay, it serves as an attachment for the posterior belly of the digastric muscle. All right. Then we have the mastoid foramen. If you look closely, there's a very small foramen here. Very small foramen here, not too clear. Okay, it transmits the emissary vein and the middle meningeal branch of the occipital artery. Now again, let's review the normal occipitalis. We look at the bones. This is the parietal bone, this is the occipital bone, this is the mastoid bone. Now for the sutures, this is the sagittal suture, this is the lambdoid suture, okay, this is the parieto-mastoid suture between the parietal bone and then the mastoid bone, and this is the occipitomastoid suture between the occipital bone and the mastoid bone. All right. Then we looked at the lambda. Okay, so a meeting point between the sagittal suture and then the lambdoid. Then we looked at this landmark here called the asterion. Asterion, we say, is a meeting point of three bones: parietal bone, occipital bone, and then the mastoid bone. We said it has a very important clinical correlation, especially for neurosurgeons, because the asterion lies above the superior sagittal. Sorry, it lies above the sigmoid sinus. Okay, we looked at the external occipital protuberance here. We said the inion is the prominent point. Then we looked at the external occipital crest, just going down. Then we looked at the nuchal lines. Okay, this is the superior, this is the inferior. Then we said there's a very small foramen here called the mastoid foramen, which transmits the emissary vein and then the middle meningeal branch of occipital artery. So again, this is the normal occipitalis. Okay, okay, let's look at the bones. This is the parietal bone, parietal bone. This is the sagittal suture. Okay, this is the lambdoid suture. This is the lambda. Okay, meeting point of the sagittal and then the lambdoid suture. This is the squamous part of the occipital bone. All right, this is the squamous part of the occipital bone. This is the external occipital protuberance, and then the prominent part is called the inion. Now going down is the crest, external occipital crest. Then we have the nuchal lines. This is the superior nuchal line. This is the inferior nuchal line. Okay, and we said there's a foramen here, very, very small foramen here. Okay, it's called the occipitomastoid or the mastoid foramen. Okay, then we have a notch here, mastoid notch. We said that it serves as an attachment for the posterior belly of the digastric muscle. Then this is the mastoid process. Okay, this is the asterion. Asterion is the meeting point of three bones: the parietal bone, occipital bone, and then the mastoid bone. So we will look at the other angles, the normal lateralis, that's viewing the skull from the side, and then viewing the skull from below, that's the basalis, in our next video. Kindly like, share, and subscribe.